Good morning, distinguished chairs, professors, and colleagues. I'm Chengyang from Sichuan University, China. It's my great honor to present our study at the 15th World Congress on Nursing Education and Practice. The title of my presentation is Early Stage Transition Shock and Autonomous Adaptation Among Nursing Students During Clinical Practice, a constructivist grounded theory study. My presentation includes 5 parts: background, aim, methods, results, and discussion with implications. First, I will introduce the background of the study. Nursing students' transition shock is closely related to future workforce retention. As shown in these slides, the nursing workforce is facing serious challenges. Nurses make up a large proportion of global health workforce. However, nursing shortage and turnover remain important problems. These data suggest one key point: retention should not be considered only after graduation. The risk of leaving nursing may begin earlier, during students' first clinical experiences. In this study, early-stage transition shock refers to nursing students' anxiety, instability, and sense of inadequacy during the student-to-nurse transition. The early stage usually refers to the first 1 to 3 months of clinical practice. This stage is often intense, hidden, and consequential. It may influence students' professional identity, work engagement, and future career intention. The existing literature leaves 3 main gaps. First, current theories mainly focus on newly graduated nurses. They do not fully explain the unique experience of nursing students who are between classroom learning and clinical work. Second, many studies are cross-sectional. They describe what transition shock looks like, but provide limited explanation of how it begins, develops, and changes over time. Third, existing strategies often focus on support from schools and hospitals. However, students' own active coping resources and autonomous adaptation strategies remain insufficiently explored. Based on these gaps, the study was conducted. The aim of this study was to explore the trajectory of early-stage transition shock and the autonomous adaptation strategies of nursing students in clinical practice. We also aim to construct a grounded theory model of this process. The third part is the research methods. This study adopts Sharma's constructivist grounded theory. This approach was appreciated because transition shock is not a fixed psychological state. It is shaped through interactions among students, preceptors, patients, and clinical environments. A total of 21 nursing students were recruited from 4 tertiary grade A teaching hospitals in southwest China. All participants were in the early stage of clinical practice within 3 months of starting clinical placement. Purposive sampling was used first, then theoretical sampling was applied. Theoretical situation was reached at the 18th interview and confirmed by 3 additional interviews. Data were collected through 2 waves of semi-constructed interviews. The initial interviews were conducted from July to August 2025. The follow-up interviews were conducted from October to November 2025, after the early stage of clinical practice had ended. This design helped us understand both students' early transition experiences and later changes in career intention. Data were analyzed in Innovinc 15 using constant comparison. The analysis included initial coding, focus coding, and theoretical coding. Memo writing, team discussion, and reflexivity were maintained throughout the process. The fourth part presents the results. The grounded theory model shows that early-stage transition shock unfolds through 4 stages: genesis, development, adaptation, and outcomes. In brief, transition shock begins with a conflict between professional ideas and clinical reality. It then develops through a series of role-related shocks. Students respond through autonomous adaptation strategies. Finally, this process shapes different career intentions. The whole process is also influenced by individual, organizational, and social factors. First, the genesis of Chengyang shock lies in the conflict between idea and reality. Before clinical practice, students often held professional ideas. They expected to provide humanistic care, gain professional value, and help patients in meaningful ways. However, after entering clinical settings, they were often assigned auxiliary, repetitive, or low-skill tasks. This mismatch became the starting point of Chen's shock. After this initial conflict, Chen's shock developed step by step. The first one was through ambiguity. Students were unsure about their position and value in the clinical team. The second was role overload. Clinical workload overlapped with examinations, job hunting, and future planning. The third was through inadequacy. Students became aware of the gap between school learning and clinical practice. The fourth was role identity crisis. At this stage, some students began to question the value of nursing itself. Therefore, early stage transition shock is not a single feeling. It's a stepwise process from the uncertainty to deeper professional identity crisis. Students were not passive in this process. They used four matched adaptation strategies. For role ambiguity, students used role positioning. They observed nurses, imitated clinical routines, and tried to find their place in the team. For role overload, students used stress management. They adjusted priorities, expressed emotions, and negotiated workload when possible. For role inadequacy, students used competence enhancement. They reviewed knowledge, practiced skills, and built confidence gradually. For role identity crisis, students used identity adjustments. Some reconstructed the meaning of nursing, while others distanced themselves from clinical nursing. This adaptation process led to three career intentions: retention, transfer, and turnover. Retention means that students strengthened their professional identity and intend to stay in clinical nursing. Turnover means that students intend to leave nursing for other career paths. Transfer intention is a particularly important finding. It refers to an intermediate state. Students may remain within the broader nursing field but avoid direct clinical work. For example, they may choose postgraduate study, nursing education, research management, or delayed clinical entry. This finding extends the traditional retention turnover framework. The final part is discussion and implications. This study offers three main contributions. First, it shows that early-stage transition shock is a dynamic and stepwise process, rather than a static state of stress. Second, it highlights students' subjective agency. Nursing students are not only recipients of clinical pressure, they actively regulate and reconstruct their clinical experiences. Third, it identifies transfer intention as a third outcome beyond the traditional retention turnover binary. Based on these findings, interventions should be shifted upstream. For nursing educators, expectation management should begin before clinical placement. Students need a more realistic understanding of both professional care and routine clinical work. For clinical managers, prospectors should reserve not only as skilled instructors, but also as mentors in professional socialization. For differentiated management, support should be aligned with students' career goals and pressure sources. Flexible scheduling and straight-field internship pathways may help students adapt more effectively. In summary, early-stage transition shock is a dynamic transition. Early recognition and process-based support may help students move from shock toward smoother adaptation, stronger professional identity, and better future retention. That conducts my presentation. Thank you very much for your attention. I welcome your questions and suggestions.